So this is looking at scaling and spreading of SusQI implementation within our organisation. So we initially planned a green team project where we opened up to applications in July and August. We reviewed those. We contacted the successful applicants. We had, I think, nine teams that entered initially. We had to choose 6 out of that. We then ran workshops, or the Centre for Sustainable Health ran some workshops, and then the project phase began. We did a finale event presentations, which was really received well, I think, by all those attended, and also the senior leaders as judges. So our projects were reducing paracetamol use, so trying to reduce that when a patient is on a stronger opioid at our palliative care unit. Extending the life of the anaesthetic circuit tubing. So this is, I think it needed to be changed every 7 days or something, but I don't think it was happening and there was no rationale behind that. So we kind of extended that out to changing that monthly. And then we also looked at the waste stream for our suction waste in theatres. The ED team who were working towards their ED accreditation, they looked at just streamlining and reducing the amount of stock that they had in their storeroom. They did about 25% of the storeroom and are planning to do the rest of it, but they made huge savings in terms of carbon and financial, but also the impact in the staff being able to find things when they look for them, and labeling all the, it sounds really simple, but just labeling the shelves where things are, and it's just made life so much easier for them. And the one in sexual health was the phlebotomy trays that we were sending off for sterilisation with no real rationale about why we were doing that. And a very simple question was asked of why. That translated in, well, we don't need to. So we looked at not doing that, just having those trays available, still using the trays so they didn't go to waste, but just cleaning them between patients, which is what they were doing anyway. And there was no need to have those sterilised. Another one of the projects was rationalising the drugs in the operating theatre. So this was looking at how our medication is stored in theatre. We have a huge amount of medication waste. We looked at all things in terms of how that's managed, who does the checks, where things are stored, how much is stored. So looking at those, they saved quite a significant financial saving there, and that work is still ongoing. And they're looking at actually moving their drugs cupboard into a specific drugs room, which is then fit for purpose, really, in terms of drawing up drugs without distractions. And so huge kind of governance and safety elements to that. And then the reusable tourniquet, which you've just heard about. So kind of what's next was, so we've promoted things through our internal channels. So we have a weekly kind of communications, and we have a Facebook page. We also have a sustainability leads network. One of the things we've recently done, in fact, the month of June, we decided very late on that we were going to do a festival of sustainability. And we've had a lot of events over the course of June, and actually these projects, we've showcased those, and it's generated quite a bit of interest across the trust, and generating more ideas for further projects in the future. So the two of the projects, the palliative care and the anaesthetic projects, they've shared across their own professional networks. The palliative care representing theirs at also a national conference. And we've achieved beacon site status, which is great. So we've got SusQI kind of embedded through our quality improvement programme now. We have a Microsystems Academy at the Trust. So that's how we've integrated and how we've achieved the beacon site status. And that's all about looking at those projects. And we have a dedicated team to support teams doing that in their own directorates and departments. We also have a thing called Change Makers, and we're also doing a thing of proud improvements, which again looks at all of our improvement projects, but then looks at them through a sustainability lens, which often isn't done. We've got a huge kind of Microsystems Academy that looks at improvement projects, but we've never really looked at them through a sustainability lens, and this is what this is starting to do now. And that's just an example of one of the change makers, and looking at our biodiversity and improving our green spaces and greener travel and transport. So we've just done a big push on active transport within the trust. And we're looking at food and catering. So in terms of that, we're looking at our menus and carbon footprint in our menus, and looking at moving towards more lower carbon options for the future for our patients, and you know, what's provided in our dining rooms and also provided for our patients.